podcast, we can tell you about that. But I think what is more challenging about endometriosis is there's no blood test that can tell you if you have endometriosis or not. There's no really ultrasound test that can totally rule it out. Now, I will say sometimes we can see things on ultrasound where we can rule endometriosis in. So if we see a cyst filled with endometriosis on your ovary, you can say, okay, you have endometriosis. But if you don't see that, I would never tell somebody, oh, you don't have it, because those little endometriosis implants, these are like little bits of tissue similar to the lining of your uterus that end up implanted throughout the pelvis and everything. You just can't see those a lot of times on ultrasound. And so I've had cases where sometimes I do IVF, and let's say it's a young person and I saw her egg quality wasn't great, who I said, you know what, I think you probably have endometriosis based on what I'm seeing, because a young person should have good egg quality. You're doing all the right things. And so maybe this could be a hint as to possible endometriosis. Now, ultimately, the treatment for severe endometriosis is IVF anyways, but that's kind of where it starts to help the patient understand what could be going on, rather than this umbrella term that they sometimes are given as unexplained infertility. Oh, you're having trouble getting pregnant. Nobody knows why. And it's like, no, now we're starting to get answers for you.